Hey everyone, today I am going to be describing and explaining first-degree heart blocks. So what exactly is a first-degree heart block? It is when the atrial impulses that are conducted through the AV node into the ventricles are slower than normal. And here I wanted to just draw and show a little visual of exactly where in the heart this impulse block happens. It occurs at the AV node on its way into the ventricles. When comparing a normal sinus rhythm strip to a first-degree heart block strip, they do look a little similar. However, a first-degree heart block strip will always show a prolonged PR interval. Every PR interval is greater than 0.2 seconds, and they are usually equal in length. So what will you see and be looking for in an ECG of a patient with first-degree heart block? There will be a long PR interval, longer than 0.2 seconds, normal P waves, one before every QRS complex, a regular rate and rhythm, just a constant delay in conduction. These are a few ways that I think can help you to remember exactly what first-degree heart block is. The first is a quote that says, "If the R is far from P, then you have first degree." The second is a boyfriend analogy where you're in a long-distance relationship with your boyfriend and you will always have space and distance between you guys, but you haven't broken up yet. So you'll just always know that there's that space between you two. And then the last is an analogy of your favorite pizza place. You order this pizza all the time because you love how it tastes and you know that you'll always receive it. However, the delivery time is always going to be late and take long. There are a couple of etiologies for first-degree heart block. First, coronary artery disease, an MI, rheumatic heart disease, hyperthyroidism, vagal nerve stimulation, and then also there are several medications that slow the impulse that can cause first-degree heart block, including calcium channel blockers, beta blockers, and digoxin. And the reason MI is starred is because oftentimes that is the cause. In regards to symptoms, there are usually none at all in patients with first-degree heart block. First-degree heart block is usually found during routine ECGs. It is always important to remember that the patient with a first-degree heart block has a regular rate and rhythm. It is their PR interval that is abnormal, and it will be greater than the normal 0.2 seconds. So what is the treatment for the patient with first-degree heart block? Well, just like how there are usually no symptoms present in this patient, there is usually no treatment necessary as well. However, as the nurse, it is very important to make sure that you continue to monitor and follow up with this patient, as first-degree heart block can be a precursor for higher degree heart blocks as well as other dysrhythmias. Thank you so much for listening and following along during this presentation. I hope this helped your understanding of first-degree heart block, and I wish you all the best of luck.